Michelle. I'm a level 1 nursing student, and I was wondering if I could shadow you today and if you could give me an SBAR report on your patient.
Sure. I have Mr. Ronald Jarvis. He's 67 years old. He's about 171 pounds. He has no allergies. He's a full code. He was admitted last night for a stage 2 diabetic ulcer. He has a secondary diagnosis of type 1 diabetes, and he has a history of type 1 diabetes for 20 years. He's also been admitted because his sugars have been 300 and up. The patient is alert and oriented times 3. He does not use any assistive devices to ambulate. His breath sounds and lungs are clear. No cough is present. He's on room air. He has been ordered vital signs to check vital signs every 8 hours. He denies any chest pain. He is currently on an 1,800 calorie diet with 2 gram sodium restriction, which we will implement some teaching. There has been no problems voiding. He has no Foley, and he has also been ordered to check the glucose before meals and at bedtime. His vital signs have been within normal limits. His blood pressure was 128/70. He's at 96% at room air, 76 heart rate. His temperature is 98. He has an IV site at the right forearm where he's getting normal saline. His labs have been within normal limits as well. His WBC came back with 5,000, which is normal. Hemoglobin A1C was 6.5, which is normal. His last glucose check was 242, and he is now due for his insulin. So we're going to go in there and give him his insulin.
All right. And why specifically is the client receiving this medication, and what action does it have on his body?
Mr. Jarvis has type 1 diabetes, which he no longer is producing any insulin. His body doesn't produce any insulin, so that is why he is on the insulin.
Okay. And when should you question administering this medication? Does it have a therapeutic serum level? And what vital signs should be monitored? And what are the physiological parameters when monitoring for the medication administration?
All vital signs need to be monitored, especially the blood glucose level. If the patient is hypoglycemic, we will hold the insulin. We would always check for allergies as well.
Okay. And what interventions should be taught to the client to ensure the medication is administered safely in the hospital setting and at home?
We would rotate injection sites while he's getting his insulin here in the hospital. We will also teach the patient how to properly administer his own insulin, how to dispose needles, and how to not use the same needles when he's giving himself insulin.
Okay. And what are the side effects and potential adverse reactions?
The main one is hypoglycemia, and we will monitor the patient for any anaphylactic reaction.
Okay. And how will you know that the medication is effective?
As long as the glucose level is within normal limits, then we will know the medication is being effective. We will always be checking for signs of confusion or excessive sweating.
Okay, thank you.
Now we're going to go in the room.
Come in.
Hi, Mr. Jarvis. My name is Sophia. I'm going to be your nurse for today. I'm with Michelle. She's a nursing student who's going to be observing me. Is that okay?
Yes.
Can you please verify your first name, last name, date of birth?
Ronald Jarvis, 67 years old.
Okay. I'm going to scan the band. Make sure I have the right patient on my MAR. Mr. Jarvis, do you have any allergies?
No.
Okay, so he has no allergies. I'm going to double check on my MAR. I have the right room, right patient. Make sure he has no allergies. I have already gotten my 2 insulins from the Pyxis. Mr. Jarvis, do you have any questions about the insulin you are due for now? You are due for your regular insulin and for your Lantus.
No, I don't have any questions.
Okay. So we will first scan the regular insulin. Make sure I have it in the mark. I will double check that I have the correct medication, the correct dose, the correct time, administration site. I will check for expiration date. Look at the solution, look at the bottle. The regular insulin is with sliding scale. His last glucose level was 242, so he's going to be getting 16 units. The next one is his Lantus. I'm going to go ahead and scan it. I'm going to check again for I have the correct dose, I have the correct medication, I'm going to check for expiration date, the solution, the time, make sure the bottle looks good, and he's going to be getting 18 units of his Lantus that is to be given at bedtime. So now I'm going to go ahead and go wash my hands, put on my gloves. We're going to go ahead and start with the regular insulin. I'm going to make sure I wipe the top. And I'll be asking Mr. Jarvis, where would you like to get your insulin?
On the left lower abdomen.
Okay. So first, we're going to get 16 units of air. Push the air. Get the 16 units out. Recap with one hand. And next is going to be his Lantus. We're going to do the same thing. We're going to wipe. Get another needle. Since these two insulins cannot be mixed. And he's going to be getting 18 units of this. Pull 18 units. Insert the air. And pull 18 units. Recap with one hand. Okay, now that I have my two medications ready, I'm going to go to Mr. Jarvis, get some alcohol wipes. I'm going to check for the site. I'm going to make sure there's no redness, no swelling, no drainage. And where would you like your first insulin, Mr. Jarvis?
On the left lower abdomen.
Okay. So we're going to go ahead and do 2 inches away from the belly button. We're going to rub with alcohol. We're going to wait for it to dry. I'm going to do the first insulin. Once it's dry, we're going to squeeze 90 degrees, inject, push it all in, wait 5 seconds, and pull out. Make sure we dispose. We don't recap, we dispose and let it in. And now we're going to do, where would you like your second dose of insulin, Mr. Jarvis?
On the right lower abdomen.
Okay, so we're going to do on the other side. We don't want to do on the same side to cause any soreness. We're going to wipe, make sure it dries. Uncap. Once it's dry, squeeze 90 degrees. Insert, wait 5 seconds, pull it out, take it out. Dispose. Take my gloves off, wash my hands. Mr. Jarvis, how are you feeling right now? Any pain, any discomfort?
No, I feel fine.
Okay. Mr. Jarvis, do you have any questions about the insulin? Do you have any questions about the diet you've been ordered?
Yeah, I just wanted to know. I requested a pamphlet to find out the diets that I can eat.
Yes, I have here your pamphlet about the food choices of what you can order for your meals. If you have any additional questions, I can make an order to have that dietitian come up and speak with you.
Okay.
Okay.
Thank you.
Any more questions?
Nope, that's it.
Okay, so here's your call light. Press if you have any questions or have any pain.
Okay.
Okay. Now I'm gonna go back to the computer. I'm gonna document everything I did. I'm gonna document what I gave him, where I gave the insulin, how the patient tolerated. I'm gonna also document the teaching that I've provided to the patient. I'm gonna put in a consult for a dietitian that Mr. Jarvis wants to talk to somebody in regards to his meals. And I'm gonna go ahead and chart it, and then I'm gonna go ahead and save it.
Okay. Were there any pertinent pieces of information you reviewed before you administered the client's medication?
Yes, we always have to review for the last glucose level before we administer the medication.
Okay. And did this information affect your decision to administer the medication?
Yes, his last glucose level was 242, so he needed to get his order amount of insulin.
Okay. And did this information affect how you administered the medication?
Yes, since Mr. Jarvis is getting two different types of insulin, we always have to change the injection site, always have to observe the injection site, make sure there's no soreness, no redness.
Okay. Thank you very much.
You're welcome. Thank you.